Prescription drug abuse taking the lives of so many Treasure Valley residents.
And people across the country as well. Tonight we focus on the effect opioid abuse has on the youngest members of our community. Fox 9's Marissa Morrison shows us how local hospitals are addressing the issue.
Well, Roland, Michelle, it's estimated that more than 2 million people suffer from opioid addiction in the U.S. The number is made up of adults, but there is a portion of the population affected by these drugs that don't have a choice in the matter. It's no secret that opioid abuse is on the rise in America, and it's affecting the smallest among us. Babies born to mothers using opioids or other drugs can experience withdrawal-like symptoms after birth.
It's called neonatal abstinence syndrome.
Dr. Stacy Seib has been with St. Luke's for more than 16 years and says he's seen a dramatic rise in opioid abuse, such as heroin or prescription painkillers, in pregnant women.
Very significantly over the last decade.
In 2015, St. Luke's Treasure Valley assisted with 6,000 births. Out of those, doctors treated 49 babies for opioid withdrawals. That's 8 out of every 1,000 babies, slightly higher than the national average of 7 per 1,000 births.
Oftentimes they appear completely normal at birth, and then many times they'll go to newborn nursery, and over a period of 12 to 24 36, 48 hours, they will start to become increasingly agitated.
Symptoms of neonatal abstinence syndrome can include trouble sleeping, excessive crying, increased appetite, jittering.
You can see that their hands shake for a prolonged period, and their feet will shake as well. Just a picture of a baby that is very, very uncomfortable.
Though babies generally make a full recovery during their time in the NICU, they can still be at risk.
I think most of the risks that go around addiction and pregnancy when it comes to opioids has probably more to do with their behavior and their social circumstances and the things that they might be doing to endanger themselves or their baby.
That's why Dr. Seib says screening mothers for dependency issues needs to be a higher priority.
I think we as medical providers need to learn how to screen more effectively our patients earlier in pregnancy and find out exactly what's going on in their lives. I think we need to offer them support, and they need to be evaluated to find out how big an issue is this in their life.
In order to help more Treasure Valley mothers and babies, the doctors at St. Luke's are developing a program to treat every aspect of addiction during pregnancy. The program will include not only prenatal care, but access to narcotic treatment such as methadone and assistance from mental health specialists.
So that we can address those types of the depression, or maybe even in some more severe type issues.
Their focus is not on punishment, but on health and recovery for both mother and child.
Our whole goal is to make sure that we provide care for you and your baby. While you're pregnant, we aren't required to report to authorities or CPS or anybody like that. And if we can help you and get you headed down on the right help and the right path, we may ultimately avoid any sort of CPS involvement. Not to mention having a healthier baby, maybe one that doesn't have to go to the intensive care unit.
And not only will treating drug-dependent mothers prevent Treasure Valley babies from suffering, doctors at St. Luke's believe it could save medical providers more than $3 million a year by eliminating the need for the extra treatment these babies require when they're going through those withdrawal symptoms. Live in studio tonight, Marissa Morrison, Fox 9 News at 9.